Tonight, a creative approach to raising awareness about hospice care.
News 8's medical reporter Jocelyn Mementa with a state-of-the-art center in Connecticut and what it's doing to reach out to patients and their families.
Hospice care, understandably a sensitive subject for families. A Connecticut hospice center is taking a unique approach some would likely describe as beyond outside the box.
The organized child has a color.
This animated approach tackling end-of-life care softens the edges of a tough topic.
The wise child says if we get hospice care, we can enjoy Dad's last months together, unburdened by his illness. She's also my favorite child. Oh, like you don't have a secret favorite?
And actually, every single story in the animation of the commercials are actual stories of families we've cared for.
Cynthia Roy heads up regional hospice and palliative care in Danbury.
I think what people don't realize when people are dying is it's about living until you die. It's not about dying. So for patients who are here or at home, who are on hospice care, it's about having the best moments they can during the time that they have left.
This Center for Comfort Care and Healing paints a home-like, sun-filled setting as families prepare to say goodbye to a loved one.
I think what people don't realize is that hospice is a supportive service that can help people be a family, regardless of what's happening.
She was here.
Families like Gurney Williams.
Well, this is the first time I've been in this room since she died last November.
His wife, Linda, spent 6 months here before dying from complications of Alzheimer's.
She died very quietly and softly in this room right there.
The decision to bring his wife of 49 years here came down to this.
It was a very careful search for, is this the right thing, and will she be warmly taken care of and pain-free in this place as she approached her death? And to the extent that you think you can do it all, recognize right now, before anything gets worse, you cannot do this alone.
Still, Linda's last days were front and center.
They have so many support systems in place. They actually feel better and they're able to do more things at the end of their life than someone who's not on hospice care.
The staff focuses on patients of all ages with any terminal diagnosis.
Hector and Emily are residents of Regional Hospice. Neither one knows how many tomorrows they have left. But today, this day, is a good one. And that's what good hospice care is all about.
Grief and bereavement services are also offered free of charge, available to anyone who has lost a loved one, even if they didn't have a family member at Regional Hospice. For more information, download the free News 8 app or go to our website, WTNH.com.